2-week quarantines do not work. They are too short. They are insufficient. The CDC knows this. There's no way they can't know this by this point. But still, they insist on holding to the 2-week quarantine time period. It's ridiculous. It's a joke. They honestly don't care. I mean, at this point, it doesn't really matter much. Coronavirus is broken out across the whole U.S. I mean, especially, states that are international hubs. Yeah, Florida, New York, Oregon, Washington, California, and more than likely more states than that. I know Utah has an international airport in Salt Lake City. It's probably already here. There's probably a ton of people in Utah who already have it, who just don't know they have it. And it's not like the CDC is going to test them. No, they're still testing people who've been to China. Maybe not, but it's kind of ridiculous. And they were so slow in getting those test kits out. Really slow. I mean, other states, and the only reason we have so many detected cases now is because states are taking the initiative on their own and testing people. It just took the states so long to get those test kits from the CDC. Yeah. I mean, it's been here. It's been here for some time. We just didn't know it, And we've seen 6 deaths. But before I get to that, let's look at this article. A coronavirus patient in San Antonio, Texas, who was released from quarantine by the Center for Disease Control and Prevention, later tested positive for the novel virus and is now back in quarantine, according to the city's mayor. The patient, who was not identified, was under mandatory quarantine at the Texas Center for Infectious Disease after being evacuated from Wuhan, China, the epicenter of the outbreak. On a State Department chartered flight, yada yada, over the weekend, return after meeting criteria, 2 consecutive negative tests collected 24 hours apart. So at least they tested them, but how did they test? I mean, did they actually do a lab test, or did they just check his temperature? And being asymptomatic. Well, we know that doesn't matter. Being asymptomatic does not matter. You can carry this thing and be asymptomatic. 2-week quarantine does not work. I mean, at least they tested him before they released him from quarantine, assuming they did a proper lab test. But, again, we get false negatives on those tests all the time. So that's not even reliable. And so, yeah, they later found out he had coronavirus. A pending subsequent lab test came up positive for the virus. So later on, another test showed he did have the virus. Oh my God. The mayor... Today we learned that the CDC mistakenly released a patient from the Texas Center for Infectious Disease who later returned a positive COVID-19 reading. The fact that the CDC allowed the public to expose to a patient with positive COVID-19 reading is unacceptable. I agree. I mean, they've totally blew it. And they did, from the beginning, they weren't even trying. I mean, 2 weeks quarantine out of people from China. When breakouts started happening in Korea, Singapore, Thailand, Iran, Italy, they're just like, hey, we're still only going to ban travel from China, and we're still only going to test people from China. We're not going to quarantine anyone else. They didn't even try. They didn't even try to contain it. I mean, they could have at least tried to slow it. They're not even trying that. They're doing contact tracing. Okay. Let me check your temperature. Okay, you're fine. We're all good. Self-quarantine if you'd like. I mean, give me a break. They don't care. So, yeah. It's outbroken in the U.S. They let this guy out of quarantine. Again, 2 weeks doesn't work. But it doesn't matter at this point. Maybe if they had been smart from the beginning and held him for a little longer than 2 weeks, a lot of the current cases that we're seeing right now could have been prevented. The 6 deaths that we see now, perhaps would be much lower. Maybe we'd still be at 0 if the CDC actually did their job from the beginning. Washington State says coronavirus death toll rises to 6. Jeez. And it's not just Fox who's reported this. It's been multiple sites who have reported this. Health officials in Washington state announced 4 additional deaths among coronavirus patients on Monday, bringing the total number of fatalities to 6. 2 of the patients were considered new, while a third death involved a patient who was previously confirmed to have virus. New. No, if you die of a coronavirus, you've had it for about 6 weeks. At least. But we can go conservative and say 4. Okay, so let's really look at these numbers. If we have 6 people with coronavirus, or died of coronavirus, and we're talking about 2%, and they say it might even be 1. If it's 1, that's 600 people out there. If it's 2, then that's 300 people. I don't even need a calculator. That's 300 people with coronavirus, right? And that was 6 weeks ago. Let's say we're conservative, and we say 4 weeks. Okay, we'll be conservative. We'll be nice, right? So 4 weeks ago, 600 people had coronavirus, right? And now 6 of those people who had coronavirus 4 weeks ago are now dead. Because to go from getting coronavirus and dying, it takes at least 4 weeks, probably 6 at least. So let's see. Let's do a quick search. Let's see if this is actually. You know what? I'm not gonna go to Google. I really don't trust Google. I'm gonna go to DuckDuckGo. See what they have. Let's see if they even have it. I know I've seen. Okay. So, anyways, I was trying to see if I could do a quick search for time it takes for coronavirus cases to double, but that's not going to be on any search engine yet. They're still working on those numbers. But I've seen, reports from other YouTube videos and stuff, and it's anywhere 2 to 4 days, somewhere like that. It could take for your coronavirus cases to double. So again, if we go conservative, let's say it's just 4 weeks, and it's taking 4 days for the coronavirus cases to double. Okay, so 4 weeks, right? Times 7, 28 days. Okay, divided by 4, that means it's doubled 7 times. So the 600, we'll say 300. The 300 cases that caused the 6 deaths we now see that were existing 4 weeks ago have doubled, right? 7 times. 300 times 2. 1, 2, 3, 4, 5, 6, 7. Okay, cool. And that's our conservative estimate. That's if it takes 4 days to double. And it's only been out there for 4 weeks. That's a conservative estimate, and that's the state of Washington. I mean, we have a handful of confirmed cases in the United States. But if you want to get an idea of how many cases are actually out there, look at the death toll. And then you got to backtrack 4 weeks, 4 to 6 weeks. Get the number of times it's going to double in that amount of time. Because, again, if you're taking active containment numbers or active containment measures, these numbers look a lot better. But, again, they're not. Okay, so I guess it is relevant how many of these people were in quarantine. I guess it doesn't really specify exactly how many of those people were in quarantine when they died. 2 of them were considered new. And I believe the first death was a community transmission as well. So, yeah, the deaths that were a result of community transmission. So I don't know those exact numbers. If it was 6, then we're at like 40,000 cases, approximately, in the state of Washington. If it was only 3, then we can do the same math, right? 3 times 50, right? So we have 150, about 6 weeks ago. It's doubled, what was my result? 7 times? That's 1, 2, 3, 4, 5, 6, 7. Okay, so we got about 20,000 cases in the state of Washington. because they're not taking active containment measures. I mean, travel hasn't been banned. Schools aren't shut down. I think maybe some places are starting to shut down schools, but that's just now starting. Before maybe the past 3 or 4 days, nobody's been taking any kind of active containment measures to contain this thing because the CDC kept coming out and saying, don't worry about it. There's no risk. Very, very low. I guess it's all relative what you mean by low risk. Yeah, you have a low risk of dying because the fatality rate is only 2%, but you're at extremely high risk of getting it. There's an extremely high risk of it being in your area already. No matter where you are in the United States, this could be anywhere. I mean, United States, people just go. They travel all the time, back and forth. It could be anywhere. You don't even have to worry about international hubs anymore. It's not going to come internationally. It's already here. So if it comes to your hometown, it's going to be from someone else who brought it there from the United States, who's visiting relatives or just on a road trip or whatever. You know, there could be 20,000 cases in Washington right now. Yeah, we don't know. How can you know? Most people who have it are asymptomatic, and they spread it asymptomatically. They can have it and not know it. And they can have it, get a cough for a couple of days, spread it to tons of people, not even realize it. And that's why it's spreading so fast, because most people, I mean, coronavirus is hyped up to be something super, super serious. So most people think, if I get coronavirus, I'm going to be really sick. No. Most people, I mean, we have 80% have mild symptoms. Only 20% get serious. The other 80% is just like a flu. If that, could be even more mild. Then they're the ones who are spreading it because they're like, yeah, I'm a little bit sick, but I'm still going to go to work because I got to get my job done. Well, that's great and all, but now you're spreading coronavirus, right? And the CDC keeps telling people, don't worry about it, don't worry about it, don't wear a face mask, just wash your hands. Yeah, washing your hands will help. It's not going to prevent you from getting coronavirus, though. You know, and they keep, don't wear face masks. Face masks don't work. Yet at the same time, they need to save all the face masks for the healthcare workers who are at risk. So if they don't work, then why do you need them for healthcare workers to protect them? They do work. You know, I mean, they're not perfect. They're not going to 100% guarantee you won't get coronavirus. You can wear a face mask and still get coronavirus. I get it. It's a mitigating factor, right? It reduces the chances of you get it. So if you have a face mask and you have goggles, your chances of getting coronavirus have gone down, right? Because you have more protection around your face, which is an entry point for this disease. If nothing else is preventing you from touching your face, that's the number one preventative measure that face mask and goggle does, is it protects you from touching your face. So, and again, they say, well, if it's not N95, it doesn't work. Well, that's not true. N95 will block out airborne virus cells. If it's not N95, it can still block droplets, right? So when someone sneezes and sends, coronavirus droplets through the air, you have just a regular face mask, guess what? It'll deflect those, right? If it's airborne, and you have the cells, so the actual coronavirus can float in the air, right? It can penetrate just a regular face mask. If it's not N95, then it will penetrate a regular face mask. So yes, if you don't have an N95 mask, you're at greater risk of getting coronavirus than people who have an N95 mask. And people with an N95 mask without goggles, they're still at risk because it could still go in their eyes. But if you have an N95 mask and you have airtight goggles, you're in pretty good shape there, right? Because you've blocked most of your entries, right, for the virus. So, but the CDC doesn't want you to know that because they don't want you to have any masks because they want to save them for themselves and for all the healthcare workers. Which I get it, they need them, but you don't got to go around confusing people in order to get your way, right? So, yeah, it's out there. It's already spreading across the U.S. It's coming to your area, and I've been saying that. The CDC isn't even trying. They're literally doing nothing. They're checking for coronavirus, and they're quarantining people who come from China and from a cruise ship. And that's it. It doesn't even matter at this point. Why even bother? You've already let it out. You've already spread it across most of the country. What does it matter? So, that's it. We're going to find out what happens when 50 to 70% of the U.S. population gets infected with a disease that has a 2% case fatality rate. We're about to find out what happens. We'll see. We'll see what happens to the economy. We'll see what happens to the supply lines. We're going to find out. This is just the beginning. My only hope, fingers crossed, my only hope is that summer helps break this thing up. If summer just come, the heat of the summer just blasts coronavirus away, fine, great. It's a winter thing, good. But if not, we're gonna see some interesting things happening here real soon. Be ready. No harm in having some supplies, and just get them now. I mean, there's already panic buying happening. It's already happening. If you got it last week, or if you got your supplies last week or the week before, you're good. Because now you don't have to go fight the other panic buyers. You don't have to go battle them for the good stuff. You're already set. You already got it. I think I need to get some beans. I have some rice, but I'm thinking, oh yeah, beans. Beans are for protein. Rice are for calories. So, yeah, that's it. Thanks for watching.